Well, the state says it's caring for about 500 kids abandoned by their parents, believing it is the only way to get mental and behavioral health care for them. Lawmakers will be meeting in about an hour to figure out how to improve services so that those children can stay at home. This is a problem that senior investigator Rebecca Lindstrom has first exposed about 3 years ago, and she joins us now. Rebecca, did lawmakers already pass a bill to fix this gap that we have?
They did, Chesley. It was a historic mental health reform bill led by the late House Speaker David Ralston. HB 1013, the Mental Health Parity Act, was paired with millions in additional funding to increase crisis intervention training for police, try to get more people into the workforce, and expand services. But even then, Ralston said this was just the foundation. He knew more work would remain.
Okay. Tell us more about these children that the lawmakers are trying to help.
We did a long series. It was a year-long series called Keeping, talking with parents impacted about the barriers they face. Now, I want to make sure people understand just who these children are. These are usually teenagers with a dual diagnosis. That means they have an intellectual or developmental disability and a significant mental health need. We talked with families who have had their children placed at facilities out of state because we just don't have that level of care here, or they have children that have been in and out of psychiatric facilities, some more than 60 times. That's the number I said, 60 times. Part of that problem isn't that Georgia doesn't have enough part of that is that Georgia does not have enough step-down services. That means it's kind of all or nothing. You're in a residential treatment facility or you are at home meeting with a therapist. There's really nothing to help the family transition. And there aren't a lot of therapists trained to work with these complex needs. The committee that is meeting today actually started their work a few weeks ago. They heard from state agencies involved in providing care to these children. A representative from DFAC stressed they are there to take care of abused and neglected children. The children that end up abandoned to their custody, these are not abused kids. They are children of tired parents who just don't know where else to turn. And she said right now the state is trying to put out a forest fire with a squirt bottle.
In Georgia, foster care is not a voluntary service. It is not meant to meet the mental health needs of a child or protect a family from a child who is a safety risk to the parent and siblings or themselves. But DFACS has become that, and we need help. I want this committee to understand that foster care is not a place. It's a legal custody status. When kids enter foster care from a hospital, they still need a place to go. If they could go to a foster home, they could go to their home with their families, and they can't. We don't have the place for them to go.
So when they gather today, Rebecca, who are they going to hear from this time?
They are going to hear from Children's Healthcare of Atlanta. They've tried to build some case management around the kids that they see revolving through their emergency room. They will hear from several nonprofits that have studied solutions to these problems, and they will hear from the Georgia Advocacy Office. That is a federal watchdog group that works directly with these families. I talked with Joe Serra earlier. He is a GAO advocate who helps families navigate the system, and he pointed out that there are 3 large bureaucracies that impact whether these children receive care, but there's not one number to call. And he says that just makes a system that is ineffective. And so they have actually filed a lawsuit trying to get the state to take action.
And what does that lawsuit seek?
A lot of the same things that we are hearing echoed by the speakers. They want intensive care coordination so these children don't keep cycling through emergency rooms. They want more residential treatment facilities, and they want those step down, those levels of care. They want to expand who is eligible for in-home services, and they want the state to increase access to mobile crisis units so they can respond faster. And I think we're going to be hearing a lot of those same sentiments echoed today at this committee meeting.
Wow, Rebecca, we will be watching that. Thanks so much for joining us today. If you want to catch up on the issues, you can find Rebecca's entire series, Keeping in the Investigation Carousel, under the News tab. That's all you have to do. We'll check back with Rebecca coming up on 11Alive News at 11:30 for the very latest developments for today's meeting.